Case 21, company worker age 52, shared by the first aid participant. He complained of fatigue. Fatigue means general malaise or weakness. Very tired and a heavy chest. Alright. And he has jaw pain. So fatigue and jaw pain. Feeling unwell. So the supervisor of the company let him rest in the rest area. This happened 10 in the morning and he rested, and obviously he got lost appetite. At 12 he didn't take lunch, he rested. So 2 hours, another 2 hours at 2 p.m, which means 10 to 2 is 4 hours. They found him unconscious with a cardiac arrest, no breathing. They attempted CPR, ambulance came, attempted, but he died, which means all from 10 to 2 o'clock, 4 hours. He was having a blocked arteries, but he didn't complain of any chest pain. General weakness, heavy chest, and a jaw pain. Sometimes the pain radiates to other part of the body. Case number 2, a woman on her 50s giving lecture. On and off during the lecture, she felt cold and clammy skin, and after that it got all right. Whenever anyone feels cold and clammy, cold sweat, it's a sign there's a blood pressure drop. It happened a couple of times. After the lecture, she hold her chest, difficulty in breathing, breathless, and she collapsed into a cardiac arrest. The colleagues got no idea of CPR and AED. So what do you think is the verdict? She died. So what really happened here in this event? She would be A, must have or could be having a blocked arteries whole day, but there's no chest pain. If you would have asked her what she could have been feeling, she could have told you that she had a heavy chest and felt very unwell and weak. But she continued work, not knowing that it was the starting of a heart attack. So maybe during the lecture, 4 or 5 hours later, the block must have been more, and more heart muscle die with a blood pressure drop and trigger an abnormal rhythm. That could be one of the reasons. Second reason for cardiac arrest for this particular woman could be she could have abnormal heart rhythm issue called palpitation on and off. So this happened during the lecture, where the palpitation or the abnormal heart rhythm suddenly turned into a ventricular fibrillation, which means the heart is just shivering, unable to pump out blood. So she hold her chest breathless and collapse. Second possible reason. Third possible reason, she could have been having blood pressure issue. The number one cause of stroke is blood pressure, among the other risk factors. So, while she's giving a lecture, the thickened artery called aneurysm in the brain just ruptured. So she must have had a hemorrhagic stroke. Most hemorrhagic stroke go into a coma for a few months, some wake up, some die. But some few cases during a hemorrhagic stroke, it could trigger a breathing to stop, heart to stop, because we have breathing center, cardiac center in the brain as well. So when such thing happen, unconscious and no breathing, sometimes they trigger into a fit before they turn unconscious. This is a sign that the brain has been affected. A good example is our DPM, Mr. Aid Jog Talk. A few years ago, it happened to him in the Parliament, where he had a hemorrhagic stroke and a cardiac arrest. But today is well and good. Why? Kudos to the first aiders who did immediate CPR, and with the help of a paramedic and the hospital team.